Today we are talking about vaccines and vaccine delivery. But in 2020, there is always a context, the context of the COVID-19 pandemic. The year 2020 has been memorable for all of us, not for reasons that we will cherish and celebrate. This is a year that has turned our lives upside down. We have lost fellow human beings whom we loved, whose friendship we cherished. We have lost jobs. We know there are many who have lost hope. We have seen the stream of laborers walking from hope back to their home, and the suffering that they have had on the way. Never for once did we feel that in the black cloud of COVID-19 that engulfed the world in 2020, there was a silver lining. The cases and the deaths, the graphs that we saw in the newspapers were no more just graphs. They were real numbers that happened behind doors of our neighbors, of our friends, of our families. However, as a global community, we have learned a few lessons. The first lesson is that we live in a world where the health infrastructure across the globe, the health systems, are fragile. We have not invested enough in building good health systems for us and our children. A lesson that we have learned the hard way. There's a second lesson that we have also learned, that wherever we are, how far ever we are, as fellow human beings, we are all connected. As beads are on a string. One weak bead and the string falls apart. Each of us must follow all public health protocols to stay safe. A safe individual, a safe community, and a safe world. There is only one hope that has kept us moving: the arrival of a COVID vaccine. A vaccine that will provide immunity and protect us from COVID-19 infection. We will return to the world we know following the vaccination, and we will adhere to the principles of hygiene, social distancing, and sanitation, just to be doubly sure. Now here lies a catch: vaccines. There's a famous saying about vaccines that I much cherish. Vaccines do not save lives. Vaccination does. Vaccines are products of pure science and technology, developed following strict scientific protocols. Vaccination is beyond science. There's an element of art, there is an element of science, there's an element of social science, there's an element of humanities. Long back in 1992, when I used to work in a non-profit, non-government organization in Churu district of Rajasthan in India, We were working to provide primary health care to 50 far-flung villages in the deserts. There were scattered 5 or 6 villages where the primary healthcare service intake was poor. The immunization coverage, particularly, was low. So one Saturday morning, we sat down to plan as to how to improve the immunization coverage in those villages. Before we sat down, I asked each of the team members to speak of what their thoughts were on this. One nurse said that actually the issue is very simple. What we need to do is ensure that there is vaccine at a place in the village or near the village which is accessible and acceptable to the community. And we have volunteers who inform the mothers to bring their children to that place. And then there is a vaccinator who gives the vaccine there. If we can ensure all of these, then there is no reason why the vaccination coverage won't go high. This led us to develop the P triad of vaccine delivery. What is the P triad? The P triad says that there must be a product which is safe and efficacious, which is a vaccine, at a place which is accessible and acceptable by the community. And at that place, there must be people who are aware of the vaccination program, and there are people who are trained to vaccinate those who have come for vaccination. This, in summary, is an effective vaccination. Now, for long, immunization or vaccine delivery happened as a standalone vertical program that was delivered relying on its own resources and delivery plans. But as the portfolio and scale of immunization program increased, so did the complexities and challenges. Eventually, immunization became part of the larger universal healthcare services or primary healthcare services. As a part of this primary healthcare services, immunization relied on not only a high coverage, but also on ensuring equity and sustainability of the high coverage. There are 4 effective pillars on which immunization in a primary healthcare setting stands. We call them the 4 I pillars. The first is integration. Integration of the immunization program into the primary healthcare service across data, review, and community mobilization. The second I is impact. Impact measurement for effectiveness of the program and any course correction required. The third is innovation. Innovations to accelerate the delivery. And finally, investments. The investments in terms of the budget, investment in building capacity of the health workers, and finally, investment in our institutions, which are domestic, to sustain the program. Every year, India targets around 26 million newborns and 30 million would-be mothers. This is the largest routine immunization program in the world. Over the last decade, our health workers have walked many miles to reach the children and mothers. Yet, there are pockets that are still left out from accessing the service. There are those who do not receive the vaccine at all. They are the left outs. And there are those who start the program and then drop out. Their immunization schedule is not complete. If we go back to our P theory that we talked about, the product does not reach them, or the program happens at a place which is unacceptable or inaccessible to them, or they are not aware of the program, or there is no vaccinator to vaccinate those who have come from the vaccination program. I do want to close here with an appeal to you. Every major public health program in India, from smallpox eradication to stopping the transmission of polio, the wild polio virus, it has happened only because of the strong involvement of you and me and all citizens of India, the common women and men of this nation. Public health cannot happen without its prime driver, the public. We need you to work with the health workers, to work with the program planners, to spread the message of immunization, to address the apprehension, the fear, and also to guide them to the nearest immunization center. Those who drop out, it is said that they drop out because of 3 A's. 1, the issue of access. 2, the issue of awareness, they are not aware. And the 3rd, apprehension, or they are afraid of the vaccine because they have heard some rumor. You are a citizen who is well informed, who is well placed to support the community to avail the services of immunization. Without your participation, without the public's participation, the program will always fall short of its goal. And what is our goal? To reach every child, everywhere, with every vaccine. Let us together build a healthy India, a stronger India, a productive India, an India for our children, for our next generation.